What is the hormone responsible for maintaining pregnancy? Estrogen, progesterone, oxytocin, prolactin. Progesterone. Progesterone maintains the uterine lining and supports early pregnancy. When does quickening usually occur in pregnancy? 6-8 weeks, 10-12 weeks, 16-20 weeks, 24-28 weeks, 16-20 weeks. Quickening, or fetal movement, is usually felt between 16 and 20 weeks. What is a positive sign of pregnancy? Amenorrhea, breast tenderness. Fetal heart tones heard nausea. Fetal heart tones heard positive signs include objective findings, such as fetal heart tones or ultrasound confirmation. Which vitamin helps prevent neural tube defects in the fetus? Vitamin A, vitamin D, folic acid, vitamin C. Folic acid. Folic acid is essential to prevent neural tube defects like spina bifida. What is the normal fetal heart rate range? 80-100 BPM, 100-120 BPM, 110-160 BPM, 160-180 BPM, 110-160 BPM. A normal fetal heart rate ranges from 110 to 160 beats per minute. What is the first stage of labor? Expulsion, delivery of placenta. Onset of true labor to full dilation, crowning. Onset of true labor to full dilation. The first stage begins with true labor and ends with full cervical dilation, 10 centimeters. A woman at 28 weeks gestation reports leg cramps. What should the nurse recommend? Walk more frequently. Take potassium supplements. Increase calcium intake. Use heat pads. Increase calcium intake. Calcium helps reduce leg cramps in pregnancy caused by muscle irritability. What is the purpose of Rogum? Treat hypertension. Prevent Rh incompatibility. Prevent preterm labor. Aid fetal lung maturity. Prevent Rh incompatibility. Rogum prevents maternal antibodies from attacking Rh+, fetal red blood cells. Which position relieves supine hypotension in pregnancy? Prone, left lateral, sitting upright, supine with pillow. Left lateral. Left lateral recumbent position relieves pressure on the vena cava and improves circulation. What is the term for excessive vomiting in pregnancy? Morning sickness, hyperemesis, gravidarum, preeclampsia, molar pregnancy. Hyperemesis, gravidarum. This is severe, persistent vomiting leading to dehydration and electrolyte imbalance. What is the primary risk of placenta previa? Hemorrhage infection, preterm labor, fetal anomalies. Hemorrhage placenta previa can cause painless bleeding due to the placenta covering the cervix. What is the term for a pregnancy outside the uterus? Ectopic pregnancy, preterm labor, hydatidiform, mole, endometriosis. Ectopic pregnancy. Ectopic pregnancies commonly occur in the fallopian tubes and are a medical emergency. What test confirms pregnancy earliest? Ultrasound, HCG blood test, urine test, pelvic exam. HCG blood test. Blood tests detect HCG levels earlier than urine tests and confirm pregnancy sooner. Which condition is characterized by high BP and proteinuria after 20 weeks? Eclampsia, preeclampsia, HELP syndrome, placental abruption. Preeclampsia, typically includes high BP and proteinuria, and can lead to serious complications. A fundal height of 24 centimeters most likely indicates how many weeks gestation? 16, 20, 24, 28, 24. Fundal height in cm generally equals weeks of gestation between 18 to 32 weeks. What is the recommended weight gain for a woman with normal BMI? 10-15 lbs, 25-35 lbs, 35-45 lbs, 5-10 lbs, 25-35 lbs. Normal BMI women should gain 25-35 lbs during pregnancy to support fetal growth. Which sign is considered probable for pregnancy? Fetal movement, Chadwick's sign, breast tenderness, amenorrhea. Chadwick's sign. Chadwick's sign, bluish cervix, is a probable sign due to increased vascularity. When is the glucose tolerance test usually performed? 8 to 10 weeks, 12 to 14 weeks, 24 to 28 weeks, 34 weeks, 28 weeks. It's performed in the second trimester to detect gestational diabetes. What is the purpose of Leopold's maneuvers? Detect FHR. Determine position. Estimate GA. Check AFI. Determine position. Leopold's maneuvers help identify fetal lie, presentation, and position. What is the danger of untreated preeclampsia? Weight loss, high cholesterol, eclampsia, hypoglycemia. Eclampsia. Preeclampsia can lead to seizures, eclampsia, if unmanaged. What is the ideal pelvic shape for childbirth? Android, platypoloid, anthropoid, gynecoid. Gynecoid. The gynecoid pelvis has a round shape best suited for vaginal delivery. What is oligohydramnios? Excess fluid, no FHR, movements, low fluid. Low fluid. Oligohydramnios is a deficiency in amniotic fluid, often linked to anomalies. Which nutrient should be increased in the third trimester? Calcium, iron, folic acid, vitamin B12. Iron. Increased iron is needed for expanded blood volume and fetal development. What is the primary role of oxytocin in labor? Prevent cramps, appetite, stimulate contractions, control nausea. Stimulate contractions. Oxytocin triggers uterine contractions during labor. What defines a nullipara? Never pregnant. Pregnant once. No births, 20 WKs. Miscarriage once. No births, 20 WKs. A nullipara is a woman who has never given birth past 20 weeks. What is the most common cause of postpartum hemorrhage? Retained placenta, uterine atony, cervical tear, clotting issue. Uterine atony. Uterine atony, lack of contraction, leads to major blood loss postpartum. Which fetal presentation is most favorable for birth? Breech, transverse, cephalic, compound. Cephalic. Cephalic, head first, is the most optimal and safe position for delivery. A patient at 34 weeks reports painless bleeding. Cause: abruptio, placenta previa, uterine rupture, labor onset. Placenta previa. Painless vaginal bleeding suggests placenta previa. What condition has dark red bleeding and abdominal pain? Placenta previa. Miscarriage. Abruptio. Braxton Hicks. Abruptio. Abruptio is the premature detachment of the placenta, causing bleeding, pain. What does a biophysical profile assess? Heart rate, fluid and movement, WT and HT, labor readiness. Fluid and movement. BPP evaluates fetal well-being via 5 parameters in Nclex: movement and fluid.